Dr. Molly with Your Goals Physical Therapy. Let's talk about back pain. Are you suffering from low back pain when you when you go from sitting and then standing? So, are you having to do this? You press your hands on your knees and you stand all the way up and then slowly walk yourself up. If that is you, you're not alone. There are many people who suffer from that. And of course, that comes with all the anxiety of what happens next, right? You know that there's something wrong with your back. You know that, right? It hurts to stand up. And you've found a way to get around it. But the real question is that something that you're going to have to do forever? Does it mean if I go to the doctor, they're going to send me to get cortisone shots and MRIs and surgeries, and am I going to be sick? How many days off from work? I mean, it just causes a cascade of other problems that you're just not really willing to deal with. And so right now you're at home just suffering because you can't sit for too long, and then when you go stand up, it really requires a whole lot of effort of your arms to get you to standing. Well, there's some good and bad news. I'm going to give you the bad news first because I'm not going to dwell on it. So the bad news is that is typically a sign that you have a disc bulge or herniation in your spine. So some level of your spine is not very stable right now. The good news is, first, that you're acknowledging that this is a problem. You're not just stuck in the I'm going to ignore it category anymore. You're officially looking at videos trying to figure out what the answer is. So it's already a good sign. And just by you being able to tell somebody that's how you feel better, that gives me, a professional in back pain, a whole lot of information. First piece of information, just telling me this one thing, that it feels better when I press my hands on my knees to stand up, is that your lower back does not feel strong enough to hold your whole body up, right? So if I go from sitting and then stand just normally, right, without having to press my hands on my knees, something is holding my whole body and helping it extend up, right? Well, if you're having to use your hands, your body is telling you that you don't feel strong enough to do that. The other thing it's telling you, because when you press down on your knees, it actually opens up a little bit of the space between the bones in your lower back, tells me that your body does not feel like it's in the best alignment. Those are two huge pieces of information that can help me dictate and give you super specialized exercises and activities to help you reduce that pain, just instantaneously. Just that little piece of information. So what does that mean going forward? Like what should you be doing right now? So first, you need to find somebody who is a movement expert, somebody who deals with back pain all the time. Because just because you have a herniated disc doesn't mean that you have to have surgery. It doesn't mean that you have to have injections, and it definitely does not mean that you're going to have pain for the rest of your life. This could be one hiccup. So depending on how long you've been dealing with that, because for most people by the time it gets to this, you've been kind of ignoring and putting up with back pain for a long time, and it can feel like there is absolutely no hope. It has only gotten worse. Why would you assume it's going to get better? And I totally appreciate that, because it would be very hard to think that what has been doesn't have to be in the future. And I'm here to tell you that I help people all the time, every day, that start off with back pain that is as severe as that and worse, get back to running and get back to lifting weights and get back to just general housework without any pain at all. And the way that we do that is by looking at how you're moving and finding out where that weakness is and how to give your body that better alignment that it's so craving that it is forcing you to do weird things. And so it becomes very hard to do that on your own, right? If you just went and did a general strengthening program, you Google, what do I do for back pain? You're gonna get some very general back exercises and some very general back stretches, which is great if you have a generalized problem. But if you're still digging around and looking for something as specific as why do I need to press my hands on my knees to stand up, you need something that's a little bit more specialized. You need something that's going to help retrain your body on how to move properly and how to re-engage certain muscles that probably aren't engaging right now. And on your own, why would your body make any changes? If you don't have somebody over there saying, you know, that looks really good, but you're not actually using the muscle you think you are, and helping you correct that, then why would your body make any adjustments? I know that if I'm working on something and I'm trying to learn a new skill, I have a coach. I have somebody who's going to help me with that. Let's take playing the piano, right? It is a very awkward thing. So if I'm trying to learn how to play the piano and read sheet music and I don't have an ear for the music, I need somebody to tell me how to play that so that what I'm playing actually sounds like Baby Shark, because what I was playing was not sounding like Baby Shark. I need somebody to give me that feedback that I am not keeping on beat, I am not pressing the right key, I'm in the wrong octave. I need somebody to help me out, please. And that is what I do for other people, is I help people with back pain figure out how to move again, figure out how to reactivate these muscles, and get them back to all the things that they never thought that they would be able to do again. So if you are looking for that type of care, please reach out to me. My contact information is below this video. If this is information that you think somebody else would benefit from, please share the video, and please like it, because that just helps more people have the opportunity to see it on their own. And I appreciate all the love and support. You have a great day. Bye.